Michael Tildesley joins us from Warwick in the UK, and he's an Associate Professor of Life Sciences at the University of Warwick. Great to have you on the show. Great to have some science on this news hour today. So you're an expert in modelling the spread of infectious diseases. Do you think the lessons that you've learned from other outbreaks can help with what we're dealing with right now with the coronavirus?
Well, I think it's actually important to be aware that no epidemic or pandemic is like the one before. I mean, there are certain lessons we can learn. So if we look back, say, to swine flu in 2009, which was also a respiratory virus, so it's transmitted in a similar way through droplets, coughs and sneezes and so forth. But of course, the evidence from swine flu suggests that actually the mortality rate for the current coronavirus outbreak is somewhat higher. So we can learn a lot from analysing previous outbreaks in how it spreads, but it's really important when we're using models to try to predict that we take into account the information that we have from reported and confirmed cases from the current outbreak when we look to try to forecast what might happen in the coming months.
And we've seen that China has is put in so many restrictions that it has it's reduced the number of infections. But is there a risk that when measures are lifted, that the coronavirus could resurface again?
And this is actually an extremely good point, and it's something that is a big concern at the moment, particularly in China. That if you look at the situation in China, round about, say, 0.01% of the entire population has been infected with the virus. And of course, the worry is that if you lift restrictions when the virus is still circulating in other countries, it could get reintroduced. So this is the challenge, that any kind of control that's put in place needs to be put in place for enough time that essentially you can protect that susceptible population. And
is there an argument that says maybe China has actually restricted the infections too much, that China has gone too far?
Again, this is a really difficult one to call, because in a sense, if you're a policymaker, what you want to do is try to reduce infection in your population. This is why a lot of the discussions that are going on in Europe at the moment are focusing around this idea of flattening the curve. What we're trying to do is delay the onset of infection in as many people as possible and reduce the height of the peak so that we can reduce the impact on the health service. It may be that a number of people become infected, but what you're doing is you're allowing the infection to spread through the population at a slower rate and thus minimizing the impact on the health service.
And Michael, how long will this pandemic last?
Again, this is really difficult to tell. If we look at the situation in Europe, what we're thinking is that we could see the epidemic peaking over the next sort of 8 to 14 weeks. The challenge is after that, of course, just the point we get to the peak, we will then potentially see a tail of an epidemic that could last many months. It's complicated by the duration that any kind of interventions are put in place. And of course, if, as we just talked about with the situation in Hubei province, if it hasn't infected a sufficient number of people, we could see a secondary peak if controls are relaxed too soon. So we could be seeing the infections in many countries lasting all the way into sort of the autumn months, say, August, September into October. And of course, the concern now is having controls in place, and of course the discussions around the development of a vaccine that we know may not happen until, say, early 2021 at the earliest.
Early 2021 at the earliest. Oof. Michael Tildesley from Warwick in the UK, thank you so much for joining us on the News Hour.